Well, thank you very much, ladies and gentlemen of the media, the Premier, MECs, and other senior officials. We just want to start. We're going to make it brief because we would like to quickly finish. We're all looking forward to the message from the President. So I hope that we can make this pretty quick. Before I move on, I just want to give you a few numbers, and then I'll come back to talk about my visit to the Eastern Cape. As of today, the total number of COVID-19 cases in South Africa has gone up to 3,465. The total number of tests already conducted is 126,937, of which 5,427 were done in the last 24 hours. We make the point because we have been increasing the capacity of testing, and therefore the numbers of tests have averaged between 5.5 to 7.1 thousand tests on the 24-hour basis. This means that in Gauteng, our report now is we've got 1,199 people who are positive. Western Cape is 1,010. KwaZulu-Natal is 671. Eastern Cape is 345. Free State is 108. It's 106. Limpopo is 27. Northwest is 24. Mpumalanga is 24. Northern Cape is 16. Then there are others who are not yet allocated, are 43. I have explained in the past that the unallocated basically means we don't have the information immediately. We sort it out after we've done the announcement. So that is the number that we have. And you must also understand that every now and again, it happens that someone is recorded as positive in one province and then they move over to another province. So you get those variations every now and again. We won't bother you with those as yet. Today we visited the Eastern Cape. As you can see, we have been well received by the Premier, MEC of Health, MEC for COGTA, and other MECs, and senior officials in government, and also mayors and members of the correctional services and various leaders in the province. One of the issues that has been raised with us has been the fact that there's been a rapid increase in the numbers of people who are positive in this province, particularly in the correctional services. You have, I think we've heard the numbers that have come out. It came out quite all of a sudden, and therefore we have identified this area as an area where we need to give special attention. In the Presidential Coordinating Committee, the Premier did make a call and request to the President that there should be an added attention to the province, and of course the President has asked us to make sure that the province of the Eastern Cape is given the necessary attention, and as a result we are here to heed that call as well. One of the issues that's also been raised has been the risk that's associated with some of the cultural practices that occur during funerals. Funerals are very sensitive events because people tend to be very emotional, and we tend to be very close, and therefore the issue of distancing becomes a bit difficult. And some of the issues we've spoken about, sharing of tools and sharing of spoons and sharing of some of the things is one of the risks that we are very concerned with, and we have to keep discussing it now in public. But the Premier and the MEC have raised a very serious concern about the situation, which we of course agree with, and therefore we took an immediate decision to urgently deploy more medical experts, including senior epidemiologists, analysts, and field consultants, to reinforce the provincial team. The team here is led by Dr. Kerrigan McCarthy from the NICD, and we've also, in addition, brought in Mr. Wayne, who is also one of the senior managers within the Department of Health at national level. His role, this one team, we've got 3 here, but MEC, we actually have a list of about 10 of them that must ultimately come and reinforce this team. And so we're going to follow that one up. And I want to apologize to you. I know you woke up from your families knowing you're going back tonight and you had to change your plans and come and join us. And same here with Wayne. Now, Wayne is in charge of the issues around procurement, particularly on personal protective equipment, and he has been asked to come on here. 2 reasons. One, they've got additional stock of PPE that they've brought with to you. And secondly, he's going to work with the MEC's office to look at the audit of the stock in the whole of the province and give us a report. We had a meeting with unions with certain comments and concerns that have come through, indicating that there were certain concerns on the PPEs, but from where we sit, we want to know what exactly is the situation on that, so we need to make sure of that. This for us is important because we need to ensure safety and adequate protection of our health workers who are at the forefront in the fight against COVID-19. We want to reiterate that no health worker should be exposed to the risk of infection. They must all be adequately trained on infection control and prevention, and they must also be protected appropriately at all times. And so it is not so much that when people want to be protected, we're doing them a favor. It is how we deal with the infection. We deal with it on the basis that we are specialists. Health workers are specialists in fighting outbreaks and infections. They do not fear infections. They don't fear outbreaks. They know how to control it and they know how to deal with it. And in our case, we know that our staff is well trained, and therefore we need to make sure that they understand everything about COVID-19 so that there should be no sense of anxiety. They must also be able to be well protected using the protective gear to be able to confidently walk into a place where there's infection, as it were. We have therefore been very pleased as we went around the province, firstly that the Premier and MEC took us to one of the hospitals, Cecilia Makiwane Hospital, where there are already lots of renovations going on. The new hospital has got a wing which is now dedicated to admission of patients with COVID-19. Right now, they've admitted some patients who are what we call patient under investigation. It means they're waiting for tests to come back, and they're well isolated. They'll then be directed once that they are confirmed. Then there's a whole new wing where there's renovation of the old hospital, where now more wards are going to be put, more than 100 wards, with additional space. Now, we want to commend the province for being proactive and moving ahead with the program. And we've also been aware that there are a number of other areas where there's been proposals for additional space. We will be visiting Port Elizabeth, where there's a partnership with the private sector to be able to open up new hospitals for COVID-19 admission in terms of field beds. Later on today, Premier, we did go to visit the great place at Ngadu, and we're very pleased here that the Kingdom, working together with the municipality, they've actually come to a point where they've created a very strong partnership wherein the leaders are the ones who are leading the front, leading in the forefront, talking to people about prevention of COVID-19. They've taught them about hand sanitation, hand washing, sanitizers. They've talked to them about masks. When I went into that place, everyone was well spaced, and they understand why, and they've also, everyone is wearing masks, and they actually were saying to us, we need to strengthen a number of the regulations. In particular, one of the areas of concern is that people who are these days, whether someone is passed away because of COVID-19 or not, we need to actually start encouraging people to move straight from the undertakers to the cemetery. And this idea of going via homes, I think they're worried that it's causing a lot of risk of infection. So we really want to appreciate the exemplary partnership that we have seen between traditional leadership, as well as municipal and government leadership right across, and all the other non-governmental organizations and religious leaders. So this is one of the examples that I thought was very, very important. They have also identified a number of areas where they believe they could assist the government to point them to possible structures where they could actually create additional field hospitals. So we have come in here, therefore, just to give encouragement to the team, and I want to say thank you, Premier, for their leadership in this case. And in this regard, there's a command structure which is led by the Premier at the provincial level, and the mayors are playing a similar role at the local level. It's going to become important as we move on, because we need to now get to a point where people understand there's going to be a change of behavior, the change of how we do our daily activities, so that we can now reduce the rate of spread. So I've actually said that we have just about 345 people who are positive. We need to really fight to contain this infection, such that in the next 3 weeks, let me say the first 200 must actually be discharged, and they must be out of the list of concern because of ill health, so that we can then focus on how to reduce the increase in the numbers of people who are infected. So as a result, therefore, Premier, I would like to hand over we've got a list of protective equipment that we will hand over to the province. I also want to also indicate here we've got some mobile units which were donated to the department by Telkom and Samsung. As you will see, Premier, these are just to assist the health workers on the ground who are going out to do the screening. Now, this we would like to donate. The Premier could meet up with the correctional services and MEC. This is a thermal scanner that has been donated by Huawei. This thermal scanner is able to detect temperatures within 3 meters of a distance, and it can actually process up to 2,500 people within an hour, which therefore means it's actually highly effective. But the good thing about it is that it spots a face that has got an abnormal temperature, and it rings an alarm. So you can spot it now in an area where you've got already a very congested environment, like the prisons and the areas where you've got a bit of a risky environment with high security alert and so on. I think when you meet up with the team at the correctional services, would like to donate that to the province to start working on that. It's going to help us to monitor. Once we've found some people who are already positive, then they need to monitor to see if there are any more people who are showing either symptoms or temperature changes. So we'll leave that with you, Premier. In the list of the PPE that is coming through, you will have MEC. There will be sets of goggles, gowns, face shields, N95 masks, surgical masks and gloves, and all of those are just to reinforce the provincial stock. But in addition, as I've said, we will work with you to look at the audit of the entire province to make sure that you are well prepared and adequately resourced to be able to face the rising numbers. They did take us by surprise, and I'm sure Premier would know. The first time I spoke to the MEC, there were only 2 people, and those people were tourists who had actually moved from Skukuza, were informed that they must watch out for COVID-19. They went to Pietermaritzburg and they got tested, but they continued. And then we had to send a message at night to say they must actually hold the hotel down with the police and everyone to say nobody leaves that place. And then they sat through and looked at it. But all of a sudden, we've started seeing the numbers rising. So I think that has actually come as quite a bit of a surprise. But I think now we are now well warned. So we just want to say from national government level, we are here, we're going to be supporting you, we're going to be working with you. But we are very pleased with the leadership that you're already demonstrating, and we are quite confident that you'll be able to manage the situation. We will always be there to do whatever necessary support that is necessary. But I want to also encourage you to continue replicating the structures where community leaders are in the forefront of talking about this issue. We obviously would want to, at some point, we need to make our people know that there's going to be a change in the way we do things, because we need to now find a way to slow down the rapid spread of the infection. It has to be slowed down. We'll not be able to completely get rid of the virus. But to slow it down means that basically that's what we mean when we say flatten the curve. It means that we want to stretch it over for fewer people to be infected at each time, so that we are in a position to develop our health services to be able to manage the numbers that might be rising, so that we don't lose many more people. So far, I think our people have really been very supportive, but of course there are areas where the concern has been raised that the adherence to a lockdown is a bit difficult because of difficulty of transport and where to obtain excuse me, where we obtain food. People have to go to town, and therefore transport problems and all of that. I think the Premier has highlighted that point quite well. But nevertheless, we still have some work to do. So that is it for today. I think if Premier might want to just make your own comments, and then of course MEC, then we can hold it at that. Thank you.
Minister, good evening, ladies and gentlemen, and welcome to also specialists. Minister, on behalf of people of Eastern Cape, we really want to express our sincere word of gratitude for the sterling job that you are doing for the country as well as for the people of this province. We all need the agility that you have just demonstrated for us to be able to confront the challenge that we have head on. This is a world pandemic which is now being declared as a national disaster. The more it gets into our rural spaces, it's quite catastrophic. We're trying our level best to contain it and make it a point that it doesn't reach to that point. We've been observing numbers growing exponentially every day. We definitely would want to get everyone on board to ensure that at a particular point, numbers will be able to be actually contained. We are very much worried, I must say. That's why we're having sleepless nights, and we've activated our structures in the province. Even in the meeting that we had of the National Executive Committee of the ANC, it was reported that this ANC structure that have responded very well with a high number of the branches, simply because we have activated our Operation Maspatisane, our ward war rooms, so that our jokes operate from the ward level, local, district, up to this level of the province. So we do have that mechanism, that arrangement that we think that is helping us. It's actually giving us some very good dividends, activating all sectors of our society, the civil society, the religious community, the traditional leaders. We are one. We are singing from the same hymn book with everyone in the Eastern Cape, and I've met with all political parties in the legislature, even yesterday. I brief them weekly. We have sessions where I take them on board, even the legislature itself. We are all connecting virtually now in these days. So everyone who's a leader here and in all the arms of the state, they are on board. We are working very well. We understand the challenge, and we really appreciate the intervention, especially of the specialists. Definitely is going to actually add more impetus on the work that we've been doing as a province, and our team is here. I think they will definitely hit the ground running. Fortunately, today as well, I've just appointed the Director General of the province. We're announcing him. That's why I didn't join you earlier in the Ngadu, a great place. So the work is cut out for all of us, and we are basically making it a point that the administration is also responding. So we have all these rapid response teams on the ground. I was looking for the commissioner. I just sent him a message to say he must join us. Probably we'll just hand over this probably after this. But we thank you, Minister, very much. Your visit here, you are going to PE tomorrow. Volkswagen there has actually donated. They are working on a field hospital. I'm talking to the MPSA, the Mercedes-Benz team as well, looking for that. And we're talking to a number of business people here, a lot of business communities also helping us with our food banks here, donating food, etc., etc. Everyone in the province is geared towards the challenge. And we definitely have to make it a point that we actually working at our optimal level and our machinery to be perfectly lubricated. So the team, especially around the PPE, there's been this teething problem around PPE. We've been going around, we've been trying to find it and address it with all different interpretations, but we want PPE. We don't want our frontline teams to be vulnerable, to be exposed, because we want these doctors, we want these nurses, we want them to be protected, for them to protect us. So we're making that call to people of Eastern Cape around the issues of funerals, that our people must understand that we've got to change. We understand that funeral are normally said events, but we become too much eventful in funeral. So we are making this plea, exactly as Minister has correctly captured it, that let's change how we handle this issue of funerals. We really don't see a need for catering now, because the more people are catering, the more people are actually transmitting the virus. The more people are digging the graves, the more people are actually transmitting the virus. So we've got to change, complete change around how we handle those issues. The issue of towns, food, people here, majority of our people in the province are staying in rural areas. They must all go to towns for them to access food. So if they come into town before 9, as the regulation says so, and they can't go out before 9, that would mean they must be in town the whole day up until 4, which is very bad. It's a bit dehumanizing. So that's why we have said, national, change these regulations. Those who are in town, they must be taken out of town, but don't allow other people to come in after 9. But those who are already inside, they must be taken out. So we are talking to different ministers as well, national, to change that, because now those towns are becoming centers of the virus spread, because people are loitering, are there in the ranks, waiting for taxis that they cannot take them outside town. So we really nervous about that. So we definitely want to limit every chance and opportunity around these issues. That's why we're making a plea that stay at home. Simple, stay at home where you are. Look after your family. Please, we need families to be together on this one. We need cohesion from that level. We need the coherence. We need everyone to understand this virus has got something to do with movement of people. The more people stay one place, the virus is contained. So the more people are moving from point A to point B, the more they make other people vulnerable. Even those who want to go to town, they must understand that they are exposing their families. So we want people to stay at home, wash your hands regularly, put your mask. That will help us to definitely reduce the chances of further infection around this issue of the virus. Thank you very much, Minister, for everything, for your leadership. We really much appreciate your leadership. Thank you so much. Thank you.
Well, there you have that press briefing that just took place, where we got an update regarding the new COVID-19 cases and the number standing at 3,465. Very important what the Premier Mabuya actually mentioned there is that NWC meeting that he spoke of. That NWC meeting also decided that there should be a comprehensive stimulus package to be announced, probably by the President this evening, and that's actually our leading story. Good evening and welcome to the special broadcast as we wait, as I've indicated, for the President later on this evening to address the nation. We will be crossing live to our political editor, Mzwandile Mbeje, who's at the Union Buildings.